Do you suffer with brain fog, migraine headaches, retinal migraine headaches, glaucoma? If you do, I want to talk about a neurophysiological syndrome called Steele syndrome and how upper cervical spine injury can be at the root cause of Steele syndrome, which can also be at the root cause of those four conditions I just mentioned. So let's talk about the cardiovascular system, the blood arterial supply. There's an artery right here called the subclavian artery, and there's two branches that come off of it called the vertebral artery, and the vertebral artery goes inside of two holes on the outside part of the fifth or sixth cervical vertebra, depending on the person, and then it travels up through these holes on the outside of the vertebra to C2, and then the atlas, which sits right under the skull, it exits posterior to the back of the atlas and then up over inside a hole in the bottom of the head called the foramen magnum. And inside of the cranial vault, those two arteries then connect into what's called the basilar artery. And then inside of the brain, there's something called the circle of Willis. It's a network of blood vessels that are all supplied through that network that we just talked about. And then, of course, off of the circle of Willis, there's other blood vessels that control the eyes, the optic artery, and so forth. So, what can happen? What can decrease blood flow or blood perfusion into the brain and affect all of these four different conditions like migraine, glaucoma, retinal migraine, and brain fog is decreased blood flow in the brain. So that subclavian artery is right here. There's a group of muscles called the scalene muscles, and they can become tight, and that puts entrapped pressure on the subclavian artery. And that can cause what they call Steele syndrome. When you have pressure on the subclavian artery, the blood flow on that side becomes less, and it steals blood from what they call the other side of the artery. And as a consequence, that can decrease blood perfusion into the brain and affect the optic artery, which can affect the optic nerve, which can affect glaucoma. There's evidence that people who suffer from migraine headache have ischemic changes, which means they have blood flow changes in the back part of the cerebellum. And all of these conditions can be tracked back to the central nervous system and a structural trauma to the upper cervical spine, most importantly, the atlas. Slips and falls, sports injuries, boxing, heading soccer balls or 50 feet in the air, slip and falls on the ice, blunt trauma can cause that top vertebra to shift and lock out of position. And when it locks out of position, one of the first things that happens is these scalene muscles tend to engage, and the normal head posture, where the head's sitting over the head, then gets drawn forward, and it can cause a whole chain reaction through the whole spine musculoskeletally, physiologically, neurologically, and cardiovascularly, which we call that Steele syndrome. So if you're suffering from the four conditions that I mentioned, their root cause can be coming from a structural problem in the neck, which then causes that cascade of neurophysiological and cardiovascular effects that I just talked about. So if you're dealing with these types of problems, you're in the Sarasota, Florida area, we have an office that we do upper cervical chiropractic work. We take 3D imaging of the neck. The corrections are no twisting, popping, or pulling. It's precision work. And the goal is to get that segment back in its normal range of motion, get the pressure off of the cord, which then allows the body to work better. And our goal is to get your body to work as good as it can. And many times, all sorts of different conditions people are suffering with go away when they get corrected. If you're outside of the Sarasota, Florida area, you can go to a website, www.uccnearme.com. That website houses upper cervical chiropractors throughout the world.